Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the crew tell you about today's specials. All right, welcome to the deli. Today in the studio, I have with me Michelle Kelly, one of our new hosts, and Katie Axford, the newbies. I guess I'm with the newbies. Now that we have more hosts, I guess Mike and Ben think they can just take time off.
They don't have to work as hard, yeah.
Apparently.
It's typical.
Right. Well, when you're head of HR like me, you got to be here, right? We also have a guest with us today. It's Ricky Thackray. I hope I said that right. Did I say that right, Ricky?
Perfect.
All right. Thank you. And of course, I have to throw a mention out to Andrew Tingley and the team here at the Health Deli Studios, helping out with all the producing and all the technical mumbo jumbo.
Hi, I'm here because I have to be.
Well, because he wants to be.
Yes, of course.
Doesn't trust us with the equipment.
So this episode today, a little bit near and dear to my heart. It sounds a little strange to say that, but it's about hazardous medication. So this is one of the things that I teach about, hazardous medication safety. And I've worked with hazardous medications in a big portion of my career. So I was an oncology pharmacist where I compounded a lot of hazardous chemotherapy agents. So I don't want you to think, though, that this episode is going to be all about like hospital-based pharmacy. We're going to try to bring it all the way down to the general public and how they can handle hazardous medications appropriately.
Sounds great.
Does it really?
It does.
Good.
It really does.
Yeah, you sounded very
I mean, these just came up in my morning, unexpected. So
Great. You got breakfast?
got breakfast, and then I had a talk about hazardous meds before I got to the talk about hazardous meds. So.
Love it. So, Ricky, a little bit about you. I could probably introduce you, but I think you do a much better job.
Well, I appreciate it. I appreciate the invite to be on the podcast today. I've been looking forward to this, so thank you very much. To everyone out there, my name is Ricky Thackray. I currently work for EquiShield Compounding Technologies, where my main focus and our main focus is to protect healthcare workers who handle hazardous drugs. Been doing this for a little over 11 and a half years with EquiShield, but I always try to get a little street cred because my wife is also an oncology pharmacist. That's how I found EquiShield. My mother-in-law was an oncology nurse for years before she retired, and my mom worked at Cancer Treatment Centers of America. So kind of kept oncology in the family.
Yeah. So you've been around it for a long time.
Been around it for a long time and had the conversations about it for a long time. So when the opportunity came to team up with EquiShield Compounding Technologies to protect those, including my loved ones, I thought it was great. And I'm based here in New York City and love it so much.
Great. New York City, that lends some credence to the Health Deli, because delis, New York City, they're kind of together, right? I mean, isn't there a lot of great delis there?
Oh, everyone has their favorite one on certain street corner. So if it's a bodega or a deli.
Nice. You get a pastrami on rye there.
Oh yeah, especially everyone knows Cat's Deli. You got to go there to get pastrami on rye.
I remember
$25 or so, but it's worth it.
I used to watch a lot of TV as a kid, and my family went to the restaurant one time, and I had to order for the first time ever by myself. I was probably like 5, and they're like, "What do you want?" And they're all looking at me, and I was like all overcome with anxiety. I couldn't come up with anything, so I just said a pastrami on rye, which is difficult to get in Central Michigan. So that was definitely not on the menu. So I've always wanted to go to New York City and order a pastrami on rye. So Ricky, just kind of interject where you can, where you want to, correct me when I'm wrong, things like that. But I know we all talk about medications, right? So the Health Deli, we're talking about medications every single episode. But this episode is a little bit different because we talk about side effects, of course, of medications and how medications can cause problems. Of course, everybody knows that. All of our listeners know that. But sometimes medications can cause side effects or kind of untoward effects for those who aren't taking the medication, which is surprising, I think, to a lot of people. So these risks of exposure can be fairly scary. So I'm going to kind of go down the list, and then we'll talk about kind of how the exposure happens, and then what we can do to prevent it. So, it's these risks of exposure to hazardous medications can be teratogenic. So
what does that word mean?
So
Mark?
birth defects. So they can cause birth defects in unborn children, which is obviously scary to everyone. They can be embryotoxic, so the next level, miscarriages, potentially. And these are obviously very scary risks. Spermatotoxic, so they can cause low sperm counts. And then kind of overall infertility issues, both for males and females, menstrual dysfunction, ectopic pregnancy, birth defects, which we already talked about with teratogenic, and then increased risk of cancer. So a lot of these agents can increase the exposed risk of cancer, which is a little bit counterintuitive because a lot of these are anti-cancer agents. And we'll get into that when we start talking about kind of classes of hazardous medications. And then the last one that I have down, and feel free to add more, is environmental contamination. So these medications can also contaminate our water supply, and they can be toxic to, fish, us, everyone else.
Yeah.
Did I miss anything?
No, the only thing I was going to add to that is not only environmental, but also when they have to be disposed of.
Sure.
In a certain way, both at home or in a healthcare setting.
Yeah, and we'll touch on disposal as well. So, so how you get exposed to these is not like, obviously you're not ingesting them because you're not the end user, you're not the patient, right? So there's a few different ways.
Shouldn't be.
You should. Well, I mean, there are end users, right? So they obviously have higher rates of exposure. Yeah. But the idea is, when the NIOSH list was developed, and we'll talk about what the NIOSH list is in a little bit, the idea was to develop a list of medications that are hazardous to those that are exposed a little bit very often. Mm-hmm. So healthcare professionals, those administering medications, and it's not necessarily limited just to healthcare, like nurses passing meds. It can be for home care as well, right? So if you are taking care of a loved one and you're handling medications, this exposure could apply to you as well. So those different routes, just to kind of think about it, could be inhalation. So it's not necessarily, I accidentally injected myself with this medication, which could be problematic, but it's even just that passive inhalation when you're crushing a tablet, when you're opening a capsule, when you're counting capsules and tablets even. It can also happen through dermal absorption, so through your skin. So if you're applying a cream without gloves, or even with certain kinds of gloves, you can be exposed to those hazardous meds. Ingestion, a little less common, but for whatever reason, a splash, a spill, something like that, and you can actually accidentally ingest it, or accidental injection. That's the thing everybody worries about, but it's probably the least common. I have no data to back that up, but there's not a lot of needle sticks. I mean, we've came a long ways in that regard with shielded needles, and there probably was more. And I've had needle sticks in my career, always clean, never hazardous meds. But I mean, it happens. If you've been around healthcare and you're working with needles 8 hours a day, 300, 270 whatever days a year, it happened back in the day. But that was before shielded needles and things like that.
Yeah, the one that's missing from here is some of those chemo agents actually like sharing a toilet.
Right.
Like so when you said caregivers and stuff like that.
Yeah.
And even, some of
that's the other thing is
pathogens
active
and stuff.
metabolites.
Yeah.
So a lot of these medications are actively excreted as active ingredients. So they're unchanged in our urine. So they have concentrations in urine, feces, blood that are dangerous. Or they have active metabolites, which means the medication's been changed to a different form, but that form is still hazardous. So even exposure to urine, feces, blood, spit, sweat, all of those things can increase your risk of exposure. So that's the kind of, I hate to be like this doomsday person where I'm like, I think there's some of our listeners thinking, man, are you kidding? Like I can just be walking by something and inhale it and be exposed. And I don't want to paint that kind of picture, but I do want to give our listeners some tools to protect themselves. One of those tools is going to be knowledge, and then some other kind of tools and things to help them reduce their risk of exposure. Any other routes I missed, Ricky? You're like my fact checker today.
No, I like it, and when I, Dr. Dan, when I speak with your class, I say the same thing: is I don't want to be the doomsday. Tens of thousands of healthcare workers handle hazardous drugs properly every day. You just have to know how they work and what to expect and how to protect yourself. The inhalation is one that sometimes a lot of folks don't think of, because certain drugs can cause vaporization when either preparing or it's mainly on the administration side. It's the disconnect that can create vapor, and then the disposal of that can create vapor.
Yeah.
So that's another route. But it's not just the healthcare worker. I know that's what we're going to focus on. And we mentioned maybe at home, a caregiver or something. But if it's in a healthcare setting or any type of setting, and you have certain contamination, dermal absorption because of surface, that can go to folks who aren't even in oncology, who are just passing by or delivering something, and can become exposed that way as well.
Yeah, when we talk about routes of inhalation, actually I did some benchtop research years ago, unpublished, but it was interesting. We had a closed glove box hood. And then we did wipe studies after compounding with an agent. So we didn't use a hazardous agent, but we used an agent that was chemically pretty similar. And then we used different devices that were meant to contain it while we compounded IV medications. And I think I have great technique. Okay, I'll be very what do you call that? Like
toot your own horn.
Yeah, but what's the word for that? Like arrogant. I'm arrogant. I have great technique, and I was never able to get to a point where there was no contamination that we found inside the hood with just compounding with a needle syringe. And I never saw a drip. I never saw anything leave the vial. But even using a closed system transfer device, which kind of contains it and it's not a needle, that was 1,000 times better with an untrained user than I was as, I think, the best compounder in the United States. So.
Well, now we might be
That was a lot of
arrogant.
police right there.
Yeah.
But it's
I was okay with what you had
what you
tooted
can't,
your own horn before, but
what you can't see can hurt you. So we call those aerosolized particles because they're leaving all the time. Other sources so now we're going to get into kind of sources of exposure. So where this is at, and I think Ricky's gonna I'm just going to tee this one up for you at the end. So just be ready. So vial surfaces, surfaces of stock vials of medications. And when you say vial, that's both oral medications and IV medications. So they come from the factory with contamination on the outside. So one of the things we'll learn about when we get into how to protect ourselves is that we need to protect ourselves starting at that point when we're handling the packaging, which is, when I first learned about this, years ago, it was really like mind blowing to me. Like that's when this starts, is before we've even made a decision to prescribe the med. It's when we're like holding on to the packaging.
Well, and that's wild to think about. So thinking back to my days in community pharmacy, right? You just get a big tote with all of the medications, and
still.
some are hazardous and some are not, right? And so having to think about that when I'm just like doing a daily task of unpacking medications to put on the shelf is wild.
so now they're marked.
Yeah. Oh, now they're separated because the normal pharmacy technician, honestly, probably the normal pharmacist would not be able to recite the NIOSH list, and we'll get into that, how big it is. Just knowing which ones are hazardous and which ones to look out for. Another one are work surfaces, and this is the one I'm going to tee Ricky up for. But the residue of these medications moves throughout facilities. It's kind of like if you took a black light. Have you ever seen one of those where you like handle something and then you take a black light
to see, on your,
like
see how
germs.
good you wash your hands.
Right. Something like that. Well, they'll do something similar. Do you want to talk about that, Ricky?
There's lots of different ways to do that. I mean, fluorescein dye people use, turn the lights off. I had actually a customer do that one time, just in their own lab. They were just working with water and fluorescein dye, turn the light off, bring a black light type of thing. You can do multiple things. What we do here at EquiShield is we try to eliminate as many routes of exposure as possible, because we know, just like you said, Mark, that we start in a hole. You get the drug vial itself. And, if you've ever reconstituted a powder, you pop the lid off of that, and sometimes there's a couple of, powdered particles on the lid or on top there. Well, that's the drug. right there. So we know what's on the outside. There's been plenty of studies that show that if you wipe the outside, starts in a hole. So you want to wear your PPE and do those things when you're just handling the vials. But you have to, if you are not starting from the beginning, from that point to close as many routes of exposure, then everything down the line has a chance to be contaminated as well. You just mentioned, the glove box in doing your own study. There's studies actually where they've used certain agents, just like you mentioned, got out of the glove box, did everything, found contamination, but what they also found was a high level of contamination in the gloves of the glove box, because you just handled everything and you're like, all right, back to work, and you put your hands back into the glove box, so the internal of the gloves being contaminated as well. So you have to start or stop the contamination or the exposure, from the very beginning. And that's what we try to do at EquiShield, is not only don't use like a normal syringe with a normal adapter with this, like those were not built to trap hazardous drug, hazardous vapor. So we try to go, from point one, opening the syringe or attaching to a vial. How can we close every route of exposure doing that? And that's what we focus on every day.
Yeah, I was in a facility once where they did a wipe study to see. So they were looking for, I think, 2 or 3 different hazardous meds. So they were just walking around wiping surfaces throughout the hospital. Now, just to put it in mind, the pharmacy was right across from the oncology suite. So they were right next to each other. But they were doing wipe studies all throughout the hospital. Mm-hmm. And where do you think they found, do you think any hazardous med got out of the pharmacy?
Yeah.
Oh, for sure.
Definitely. Where do you think it was?
I'm going to go with the bathroom.
So,
no?
I don't think they did.
All over.
It was all over. But the highest concentration they found, elevator buttons.
Yeah.
Everybody touches elevator buttons.
Yeah.
There were door handles. Even in the farthest reaches from the pharmacy, they found small amounts of hazardous meds. So the idea that we can contain it is so important, right, Ricky? Like you said, we need to be intentional, and you need to think about it from the time you get it until it's completely left the building, like Elvis. And because once it's out, you can't bring it back. It kind of gets out there.
I agree. I did an interview with a director of system pharmacy for a health system here in New York, talking about how do you attack safety? Who do you bring in? And he made a good point of we always think we need to bring in our pharmacy team and our nursing team, but they brought in environmental control and risk management and everybody. There was a panel of 10 to 15 people, he said, to talk about it together. It's not just those who are handling. Like Cleveland Clinic did a study back, I used to say recent, but I think it's 10 years ago or so, where they were looking for surface contamination throughout their facility. And they found that there was contamination on a office assistant's desk who didn't work in the infusion suite. But from my understanding is that she shared the door. They went up to the oncology suite this way, her office this way, and there was a door in between. Well, the door was contaminated. So when she pushed it to open it and it started working, they found it on her desk. So yeah, it's very important to start, because it's not just where drugs are given that it can spread to.
Right. So other sources, though, are obviously administration. So when you're administering medications, you could be exposing yourself, and this could be for a non-healthcare professional. So if you're giving medications to someone you're taking care of, child, spouse, parents, whatever it is, that there's certain things you need to think about as well to protect yourself from that medication. Waste handling is a big one. So how do you get rid of these? And when I say waste handling, that's all encompassing of urine, of feces, and those kinds of things, to make sure that all of that is being at least handled with some idea that this could be hazardous to those users. And then aerosolized particles, which we already talked on. Those require some specialized equipment, which we may or may not get into during this episode. But the idea is that these particles are leaving constantly when you have any kind of manipulation. So if you're using just a vial and syringe, it's really not good enough. You need what's called a closed system transfer device, which is what a company that Ricky works for manufactures, and those trap those aerosolized particles, and they're actually really, I think, really cool. That they don't that they can trap those particles in before they become a problem.
How do you dispose of the EquiShields?
Great question, Ricky.
It's a great question. When we get asked often, it's the same way if you were using your hazardous waste. If you weren't using a closed system, it goes in the same bin.
Okay.
Yeah, and there's 3 levels
because there is a needle in it. But yeah, so you put it in your hazardous sharps. Waste.
Yeah. When we touch on hazardous disposal, we can get into that a little bit. There's basically 3 levels of hazardous waste. There's more than that. There's 3 levels inside the health system. There's probably really like 5, but yeah, it's no different than disposing of a needle and syringe in that category.
Gotcha.
So, well, before we get into the NIOSH list, which is pretty heavy, I think we should pause and take a minute for the Healthy Minute. Let's pause for the Healthy Minute, brought to you by the Winery at Young Farms. Today's Healthy Minute is develop a wellness plan. A wellness plan is a personalized approach to achieving and maintaining your health and well-being. It includes setting achievable goals in areas like nutrition, exercise, stress management, and sleep. By creating a plan tailored to your needs, you can make positive changes that lead to a healthier, more balanced life. Starting a wellness plan is not about making drastic changes overnight. It's about taking small, consistent steps towards a healthier lifestyle. Whether it's incorporating more fruits and vegetables into your diet, finding a physical activity that you enjoy, or setting aside time for relaxation, every effort counts. Invest in yourself and your future by developing a wellness plan today that supports your overall well-being. That was the Healthy Minute, brought to you by the Winery at Young Farms in Mecosta, Michigan. Please visit www.thewineryatyoungfarms.com for more information. Now, back to the Health Deli.
Do grapes count in the wellness? Fermented grapes count into my wellness plan?
That's a fruit serving,
it's
Michelle?
A fruit, yeah.
Every day?
My favorite fruit is wine. I don't know, maybe.
Did you talk about that on the episode about wine? And alcohol?
We did, actually.
You should go back and listen to that episode.
That was like season 1. That was right off the bat.
That was, 1 or 2.
Yeah. Actually, we should have another alcohol and your health episode because there has been new research since that episode.
Yeah. Is this research that lets us drink more?
We got it. We'll have to find out in the episode. You can't let it out of the bag.
Not sounding good.
Well, hey.
I did just see something about alcohol and dementia, and I don't think it was in our favor.
It might be
Andrew.
conflicting with Mark's other employer.
We should talk about the NIOSH list.
Yeah.
Let's go to the NIOSH list. Alcohol, not on the NIOSH list.
Yeah.
Thank goodness.
Well, I don't know. Isn't it teratogenic?
It's not on the list, though.
I know it's not on the list, but it is teratogenic.
It is definitely teratogenic. At one time, I don't know if I can say this anymore, but 10 years ago, alcohol was the #1 cause of birth defects worldwide.
Yeah, I would think that and tobacco.
Yeah. So
that and
fetal
smoking.
alcohol syndrome. But I don't know if that's still the case. Probably. So let's get into the NIOSH list. The NIOSH list, the current NIOSH list is from 2016, although it has proposed updates in 2020, and I think it's going to be published. A 2023 list is going to be published any day. That's not been published, right, Ricky? Or has it?
Not that I'm aware of. I knew the 2016 was the last final, and then the 2020.
Yeah, I think it's going to be, it sounds like any day. But any day to the CDC may be, a year out, or it might be actually tomorrow. So it's very extensive. It's very long. I don't know how many pages, 40-ish pages, 45 pages long. There's a lot of information in here. Now, I will say, if you go to the CDC website and just type in NIOSH, which is NIOSH, list of hazardous meds, or maybe even just NIOSH list, you can probably find it. And it categorizes medications based on their risk. So they look at things like carcinogenic potential, so whether or not it causes cancer or can cause cancer. Teratogenicity, of course, we already talked about that. Reproductive toxicity, organ toxicity at low doses. So a lot of medications cause organ toxicity, right, over long exposure. But this is more concerning for organ toxicity at very low doses. Genotoxicity, so like
Our genes.
can it bother your
DNA.
genome? Yeah, change DNA, which a lot of medications change DNA. And then other structure and toxicity profiles of new drugs that mimic those that are already on the NIOSH list. So the NIOSH list, even though it hasn't been updated since 2016, they actually have kind of a catch-all that if a new drug kind of looks like a drug that's on the NIOSH list, we're going to just say you should probably treat it like it's on the NIOSH list until we really know, because new drugs are coming out all the time. So it's set up in 3 different tables. Table 1, 2, and 3.
How creative.
I'm very creative. Why don't they call this like, panda and zebra or something? But table 1, 2, and 3. And NIOSH is very intentional to say that this is not a rank order. Like table 1 is not necessarily more hazardous than table 2 or 3. It's just a little bit different. There are some healthcare professionals that have that misnomer that believe that table 1 is more dangerous. It's not necessarily more dangerous, just kind of a different kind of dangerous. So group 1 or table 1 is what I generally think of as hazardous meds. And these are your anti-neoplastics, so your chemotherapy meds. So they basically prevent new cell growth, anti-neoplastic. These are your heavy hitters. These medications must be handled with special precautions. And we're going to get into special precautions kind of towards the end of the episode, but there needs to be special handling precautions no matter what, without exception. And that could be gloves, that could be masks, that could be all sorts of things. Some of the examples that maybe our listeners have heard of: methotrexate, kind of a classic hazardous medication.
Sounds kind of unique because a lot of people use it for rheumatoid arthritis and not.
Yeah. So these are
cancer.
medications that you definitely will see, in the public domain for sure, not just, in a chemotherapy situation.
Right. And meds that people would have at home and that they would be taking themselves that other family members would potentially be exposed to.
Yep. And this one I always struggle saying, and I know I'm a pharmacist, so I should be able to pronounce all meds appropriately, but is it Magestrol or Magestrol?
I say Magestrol.
Magestrol.
I'm going to second that.
Okay, so that's what we're going to go with. So that is actually on this table 1 as well. Another one that may be common to some listeners is tamoxifen. So very common for breast cancer survivors. But all of those medications require special handling precautions, which we're going to talk about later. Really save none. So the other groups, table 2 and 3, do have some special exceptions where you don't need any specialized equipment or a specialized technique. So table 2 are non-anti-neoplastic, so not chemotherapies, but they meet one or more criteria for a hazardous drug, and then also represent a reproductive risk. So there's, maybe they have a carcinogenic potential and a reproductive risk. That would land them in table 2. And these are more of the common medications that you're going to see out in the public. So things like carbamazepine, not real common anymore, but at one time pretty common. Brand name Tegretol, divalproex or Depakote, estrogen and estrogen progesterone combinations. So those at one time, I think, like the best-selling prescription medications in the United States back in like the 1990s, at least in the top 10, those medications are considered hazardous because that estrogen exposure, even at very small doses, can cause cancer. They can cause reproductive changes as well.
Yeah. And I think thinking about that as oral contraceptives, I think people think birth control or oral contraceptive and don't necessarily relate that that's an estrogen product typically in those.
But I mean, even if you stand way back and you have no healthcare experience, if you're trying to get pregnant, you don't want to be exposed to hormonal birth control, right? I mean, that would be counterintuitive. But it's more than that. So even that long-term exposure can be carcinogenic as well. So endometrial cancers is the one that we're probably most concerned about. But it's not just the fact that maybe they're not as likely to get pregnant. There's also a carcinogenic effect. Spironolactone, too, very common medication, lands on table 2. So I think, hopefully the listeners are starting to hear some medications that maybe they're familiar with and saying, wow, I don't do anything different. Well, what should I do different if it's in table 2? So if it's in table 2, just handling unopened intact tablets main is probably not a problem. So if you're just taking tablets, giving tablets, probably not a problem if you're a table 2 med. You don't need any special gloves, although I always recommend using gloves if you're handling medications for someone else. But you don't need anything special to protect yourself from those meds. And then group 3 are non-anti-neoplastics that primarily have only adverse reproductive effects. So no other criteria, just reproductive effects. And this list is longer. They have the same precautions as table 2. So intact tablets, if you're not crushing them, if you're not opening capsules, you're fine to just use regular gloves. Nothing really special. But there's a whole bunch of clomiphene. So you guys probably know Clomid as a medication to actually help people get pregnant. Stimulates ovulation, right? So
Right.
I know very little about this because I've only worked with old people my whole career, and they're not looking to get pregnant. But when I was looking through the list, it kind of surprised me because I'm like, wait a minute, like why? Like you're taking this medication to get pregnant, like. The end goal is to get pregnant. Right. This is actually a pregnancy category X, though. So as soon as you become pregnant, you want to stop
not
it.
Take it.
Yeah. So kind of interesting. Clonazepam. So Klonopin brand name. That can have birth defects in the first trimester. So that can be hazardous to those who are pregnant or want to become pregnant. That's Mother's Little Helper, right?
I thought that was Valium.
Oh,
is it Klonopin?
Andrew, Google it. Mother's Little Helper.
I was going to say, did none of the other ones show up on the list?
They do.
Your Xanax and Valium, they all are on there, aren't they?
Doesn't it? No. Klonopin, there's a couple. I can look actually.
Like
but a few of the benzos. I don't think Zolpidem does. Let me look. No. A lot of this is in those medications. So temazepam or Restoril does show up. A lot of those medications might be caught by if it looks like it, It's also on the NIOSH list, that statement. So
but they're like old drugs that you'd think they would have shown.
Yeah, they're just
We've had long enough to notice if they look alike.
That is true. They might just not have been implicated, individually. While he's looking at,
Mother's Little Helper is Valium.
Dang it. Made by the same company. I don't know. You remember do you ever remember counting brand name Valium?
Yeah,
what the tablets looked like?
They were the little blue or no?
Brand name.
I don't
so
know.
the brand name were round and they had a V cut into them for Valium, and the Klonopin had a K cut into them. That kind of cool looking.
There's a song by the Rolling Stones called "Mother's Little Helper."
Yeah,
1966.
You're not familiar with the song?
Well, I am now.
Oh, we should throw it out as the outro. All right, so we're getting off topic. Another one, finasteride, which we're going to learn about in an upcoming episode about hair loss. Paroxetine, so Paxil, very common medication,
very common.
Also on the hazardous list. And then one that I included because it's in table 3, but it actually requires some kind of special use, and that's tretinoin cream. Because even though intact capsules and tablets, you don't need special gloves. If you're administering a cream that's hazardous, you do need special chemotherapy rated gloves, and they should be double layered. So tretinoin cream is very common, right? It's an acne medication. And if you're, trying to get pregnant and handling this cream, that could definitely be an issue. Warfarin. That's the last one I have. Also very, very common. So there's a lot of medications
Thankfully getting
out
less
there.
common, but
Yes. So what can you do to protect yourself? So, Ricky, talk about closed system transfer devices.
I will, and I do every day.
Good.
I kind of missed that in the intro where I said we protect healthcare workers. I didn't say how. We do that mainly with our closed system transfer device. But you mentioned a couple of things there that I wanted to touch on as well, because we talked a lot about those drugs that help you get pregnant, and you should stop once you become pregnant. But we know over half of pregnancies are unplanned, and so a lot of people don't know that they're pregnant until something happens. You miss a cycle, or you feel sick, or you take a test, or whatever it may be. And if you're handling hazardous drugs, while pregnant for 6, 7, 8 weeks and not knowing that, that can cause harm to the fetus. So there's lots of ways to protect yourself while handling hazardous drugs. What we focus on at EquiShield is stopping it from the start. Just like we mentioned with surface contamination, we try to stop it from the start. I'm the national training manager for EquiShield on the sales team. So I start every training off with, we are not comfortable with any level of contamination. And if you go to someone and say, all right, I'm here to train you on how to handle these drugs, what level of contamination are you okay with? Are you okay with 20%? No one's going to say yes to that. They want to stop it from the very beginning. And so what we do with EquiShield is that we say nothing in, nothing out. Everything should be contained within the system. So with EquiShield, we have a special vial that goes on any size vial that you might come in contact with. In the United States, there's 3 sizes. You have a 13 millimeter neck, a 20 millimeter neck, and a 28 millimeter neck. And for example, that's vincristine for the small ones. Most drugs come in a 20 millimeter neck, and then you have, the large cisplatins or something like that comes in a 28 millimeter neck. But vial diaphragm goes on that stops any vaporization being able to leave, any drips or drops. It has a membrane at the end. The difference between what EquiShield provides compared to any other CSD, and it doesn't matter what drug you're working with, is that we have a special syringe for it, and we do that on purpose. Because going back to stopping it from the source is syringes have been around forever, right? 50s and 60s and 70s, we were using the same type of syringe that is used now in a lot of cases and with other CSCDs. But our syringe is closed on every end. The back of the syringe is closed. The front of the syringe is ultrasonically welded with a membrane connection. The sterile air is inside of our syringe, so you don't have to draw anything from the outside, and you're not venting anything out when you're reconstituting. So the way EquiShield works is that it equalizes pressure as you withdraw medication from a vial, or as you're pushing into a bag or administering to a patient. No vapor is escaping; it's all contained. So that's the way that EquiShield protects healthcare workers, is that we say, hey, if you're going to be handling this, we're going to keep you as far away from it as possible. That way you don't become exposed to either the drips, the drops, the micro exposures, or the aerolizations. And then we can eliminate everything we just talked about. Surface contamination, the stone going downhill at that point is just picking up contamination. We'll eliminate all that.
Yeah, I was at a conference once, and in the vendor area, this was when closed system transfer devices first came out, and I can't remember if it was EquiShield or a different company, but they were manipulating vials that had Starbucks coffee in them with like a needle and a syringe, and you could instantly smell the coffee, and then because it was escaping, right? So it was a really good, I can't say visual, olfactory example. And then they would manipulate with a closed system transfer device, and you couldn't smell anything, and it was really like eye-opening, nose opening for me. Opened my mind to, wow, just because I can't see it doesn't mean it's not there. So interesting. So in the interest of time, how can you protect yourself at home? Probably your biggest tool here is knowledge. So if you go to the NIOSH list, table 5 of the NIOSH list gives you what kinds of protection you should use for the route of administration and for the table of medication. So you can find the medication in the NIOSH list, hit Control F if you're one of those people, and then go to table 5 and figure out how to protect yourself from it. One thing are gloves at a bare minimum. And then anything in table 1, you're going to need double chemo gloves, or anything that you're administering topically, like a cream, ointment, those kinds of things, double chemo gloves as well. When you're disposing of medications, just in the interest of time, we're not going to go way down that route, but I will say that normal drug take back events, or like those mailbox looking things that you can put prescription medications in, are not meant to be used for hazardous medications. So you really need to reach out to your pharmacist and figure out the best way to get rid of a hazardous medication. There are ways.
And is that all 3 tables? Because again, thinking about some of these really common anti-anxiety, antidepressant medications
And there are some mixed use take backs that will take back medications from tables 2 and 3, but not 1.
Sure.
So it's specific. So I don't want the listeners necessarily to be making those decisions. Reach out to your pharmacist. They can help you kind of guide through that. Well, I think it's about time to hang up the sign. Ricky, thank you very much for joining. I think it was a great episode. Appreciate you being here. Michelle, Katie, you guys coming back for another episode, or you guys?
We're
quitting?
taking it day by day.
Good. That's all.
Contract
we don't want.
employees.
You're not a temp, are you?
Yeah.
No, they're.
The pay is not great.
The
so
pay is
far,
terrible. The pay is
so-
terrible. You get no perks. There's no bennies. Well, thank you, Ricky, for joining us today. It was very informative. Now, you have a podcast too, right?
I do. I am the podcast host for EquiShield. We have a podcast called Fully Closed, a podcast with no filters. Little fun on word there about
I like that.
trapping everything in. So if you're love safety, it's not all about closed system transfer devices. We just talk about safety in healthcare. Please find it wherever, either Spotify or Apple Podcasts.
Awesome. Fully Closed, a podcast with no filters.
Correct.
Nice. All right. So, find that on Spotify or wherever you get your podcast. You guys coming back next week, Michelle and Katie?
We'll see.
Well, this is a great gig because look, we're done early, so we're going to hang up the sign and get the heck out of here.
All right.
Thanks for stopping by the Health Deli. Come on back to learn about specials, ask questions, or just to say hello. We are open 24/7 at thehealthdeli.com or follow us on social media at The Health Deli to get alerts about fresh topics. As always, we want to give a special thank you to Andrew Tingley and the students in the Ferris State University Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free.